Any of you guys who are new to me, please feel free to say, hi, Cindy, who you are. So I am SHIEVA GHOFRANY. I'm an OBGYN here in Connecticut. My tag is Big Love, Fierce Juju. So actually, I'm going to try to tag that right now because we have a lot of stuff that we need to go over here. Hold on. So hi to everyone who's here. How do I tag this? Oh, I'm going to post it. So hi to everyone who's joining me again. How do I pin this? Who knows how to pin? Oh, there. Good. Okay. So I pinned my comment. Hi, Jenny. So for those of you who are joining, I am SHIEVA GHOFRANY, OBGYN here in Connecticut. I am deeply grateful. Thank you, Hatch. You guys are great. And they've asked me to do their Instagram live takeover today. I've never done an Instagram live takeover. I do Instagram live sometimes. I talk a lot, as anyone who knows me, but I haven't done someone else's. So this is my first time. So wish me luck. And guys, ask me questions. I'll try to keep looking down, but I want to kind of keep the flow going as well because we have a lot of things to talk about. This is mostly going to be pregnancy and COVID, but I really want to throw in a couple of nuggets for you guys of just ways to decrease anxiety that I think can affect all of us, pregnant, not pregnant, women, men, if you're joining, anyone who wants to listen. What I really want to talk about in general with regard to pregnancy and COVID is the data on pregnant women and COVID, because that's really important. And we don't have a ton of it, but what we have is very encouraging. So pregnant women and COVID, babies with the pregnant moms and COVID. Should you try to get pregnant during COVID? What the fertility doctors are doing right now, which actually as of today, things have improved. What's going to happen when you get to labor and delivery? And that varies hospital to hospital, but there are a couple of generalizations that will apply here. And then what should you do with your family and letting them visit? I know there was a specific question about cesarean sections, not necessarily with regard to COVID. So if we have time, I will get to that, I promise. And for whoever asked that question, if I don't get to it, please feel free to reach out to me. I will talk about C-sections, vaginal deliveries till I am blue in the face. Okay, let's first talk about pregnancy in general. As you guys know, since we're talking about COVID and pregnancy in general is not only an anxiety-provoking time, but you are considered immune compromised when you're pregnant because your immune system is just not as robust. We see that when it comes to things like the flu. The seasonal flu tends to hit pregnant women at a preferentially more challenging way. So they end up getting the flu more frequently, and they end up getting sick from the flu, unfortunately, in a more intense manner. That's why pregnant women are recommended to get the flu vaccine. The good news has become that that did not seem to occur when it came to COVID-19. We were deeply worried. If you asked me 5 or 6 weeks ago, right when we were on the cusp of this, as an OBGYN, I had a lot of anxiety with regard to what was going to happen to my patient population, the fact that we didn't have enough protective equipment to protect ourselves and our patients from us. So there was just a lot of unknown and a lot of anxiety. The good news is that, oddly, pregnant women have not seemed to be significantly affected more than non-pregnant counterparts. The data we have, you can probably guess, is not hugely robust. First of all, pregnant women don't get studied very frequently, but also pregnant women in general right now are in a situation where they're being carefully evaluated, but the data just isn't being published yet. The data we do have, especially out of Columbia University, has been great and has really comforted us. They've looked at pregnant women who have COVID, who have birthed, and the vast majority, if not all of their infants, are COVID negative. So let me repeat that because that's really important for those of you who are pregnant right now. I want you to feel comforted that the babies who have been born to moms who are COVID positive were negative. The babies were negative. And that's even those moms who were deeply sick. In general, like I said, most of the mothers have not gotten as sick as we had thought if we compared to the flu. But those who were sick, who were intubated, the good news is that their infants have been fine. There are many women who are sick with COVID during pregnancy and can be managed at home because they're able to breathe and do all the things that we would expect for them not to be hospitalized. Okay, so first of all, the data we have is really good. There is some data out of China and England. There were a couple of cases of infants who were actually positive, but those babies didn't get sick. So they were clinically okay, which is also a really important thing. Unfortunately, there have been a few cases in America of infants who have passed who had COVID. They don't know how they got COVID. They don't think it was vertical transmission through the placenta or through the amniotic fluid. It might have been after the delivery through droplets, those particular infants who did pass, they still don't know if it was because of actual COVID. So we have to be really careful about what's causing things and what's just correlated. We have seen correlations of things that have not necessarily been because COVID was the reason, okay? Interestingly, they are starting to find that maybe estrogen is a protective component when it comes to COVID. So just yesterday, they were talking about the fact that women tended to fare better with COVID. We know that. Pregnant women have fared better than we had expected. And maybe that link is estrogen. And there was just an article talking about, and I find this wildly entertaining, that they were starting to try to treat men with estrogen who are COVID positive, which is so ironic. Like men are always trying to, avoid the fact that we are fraught with estrogen, and now they might get treated with it, which again, I shouldn't be so jokey, but I found it entertaining and I thought that was good. So again, the data on pregnancy doesn't mean that you shouldn't be cautious. And this is where I want to pause. And anyone who is my people on this feed would know, I talk about anxiety a lot, and I talk about our mindset with regard to trying to be proactive without being paranoid. I have patients who say to me all the time, should I be really scared right now? Should I be really worried right now? Oh my God, is this when I should freak out? My answer is always going to be, no, don't ever freak out. Never in the history of ever, I always say this, never in the history of ever has freaking out or being scared helped you, unless you were being chased by an animal in the wild, which by all means, then I would say, be scared because it will propel you to run faster. Short of that, please don't be scared right now. That does not mean throw 3 sheets to the wind, bury your head in the sand. I am a proponent of not being paranoid because I want you guys to be able to be proactive. I'm holding my mask. Do you see that? Because I want to talk about this. I think that initially there was like this huge, should you wear a mask? Should you not wear a mask? Oh my God, people wearing masks are being crazy. The people who aren't wearing masks are being crazy. Here's where I'm going to net out. Now that we know that the CDC has recommended that we all wear masks, I can say with confidence, please wear a mask. As a pregnant woman or someone who's trying to get pregnant or a generally healthy person who's trying to avoid COVID, I don't advocate for you to be, oh my God, so scared. I'm never going to leave the house. I think this is the worst thing in the world. And I'm going to wrap myself like a mummy when I leave the house. But I am a proponent of you saying calmly to yourself, I'm going to do everything I can. I'm going to wash my hands frequently. I'm not going to touch my face. I'm going to wear a mask when I'm in public. I'm going to make sure that I am physically distant whenever I am anywhere where there are other people. And the reason I'm very specifically choosing physically distant is one component of COVID that I am very worried is going to affect us as a population and certainly as pregnant women is this notion of fear and socially disconnecting yourself. We don't want that. We want you to be physically distant in a way that keeps you safe without being so racked with anxiety and paranoia that your psyche gets so damaged that the stress hormones affect you worse. So please, please, please take that to heart and really think about whether you're pregnant or not. You can't allow this part of your life to just, close the door and be done with it. You have to try to make the best of this situation, which means proactively taking care of yourself while making sure that you keep yourself as emotionally connected as you can. This is a funny way, but I feel like Instagram has really helped people connect. So I'm glad about that. Okay. And again, so we said infants born to moms with COVID have actually fared fairly well and have largely been negative. Should you try to get pregnant right now during COVID? This is what I've told my patients. There's no data saying you shouldn't try. I am a proponent of knowing yourself. So first I would say, if I discourage trying to get pregnant right now, it's really only for a period of a couple weeks. So if someone asks me, my response is, maybe wait a couple weeks until we know a little bit more about what's going to happen. But frankly, I said that a couple weeks ago, and we don't necessarily know that much more. So what I really mean by that is, if you're the type of person who every time a new nugget of information comes about, it's going to freak you out and make you anxious, then maybe take a couple months to really wait. Because when you're early pregnant, many of you know this, you might have to go to the doctor more frequently. In an ideal world, you find out you're pregnant, you don't go in until about 8 to 9 weeks for your first ultrasound. Many patients are even pushing that to 9 to 10 weeks right now. But there are very frequent times where a little bit of spotting or bleeding or pain will propel you to have to go to your doctor's office. If that is going to freak you out or cause you not to go to your doctor's office, or for whatever reason you don't have access to your doctor, then that would be a reason for me to say to you, hold off on getting pregnant right now, because you don't want to put yourself in danger by avoiding medical care merely because of COVID. So again, there's no rule saying you shouldn't try to get pregnant, but in general, I would say you know yourself best. If the anxiety is going to get the better of you, holding off for a couple of weeks or months might be best. The reproductive endocrinologists and fertility doctors, so REI doctors, for a while, many of you might know this, had to actually stop doing any of their procedures. They had to stop doing all of the transfers. They had to stop doing any IVF cycles. And that was kind of a mandate from their governing body. And luckily, as of yesterday, they were able to open up again and start their cycles back. So they're not doing procedures that need anesthesia unless the patient tests COVID negative, but they are doing transfers. They're doing the hysterosalpingograms, the ultrasounds, the workups. So call your fertility doctors if you were put kind of on the freeze, no pun intended, because you might be able to go back this week or next week and restart all that. Okay, so that's a huge boost because they have very good academic information. Okay, let's talk about what happens when you get to the hospital. Now, every hospital is different, but by and large, in the last 2 weeks or so, many hospitals have adapted, for the most part, the same procedures about how they're testing. So you will go to labor and delivery if you think you're in labor or if you're scheduled for your C-section or any other medical reason where you're worried. At our hospital, which is a fairly good-sized hospital in suburban Connecticut, so we follow a lot of the same rules that many of the hospitals do. The minute the patient knows she's staying, meaning she comes in labor or she's there for a C-section. If she's in a rule-out labor situation, then her partner will be asked to wait in the waiting room until she has been determined that she's going to stay. Once she's ruled in and she's staying in labor, she will get tested. At our hospital and many hospitals right now, it's the oral test, not the nose test. The good news is the oral test is not as aggressively uncomfortable as the nasal test. It may or may not be as effective, but it's fairly effective. So oral swab, she gets tested. Right now at our hospital and many hospitals, it's about a 30-minute turnaround. The minute they find out she is negative, then her partner can come in. He or she, the partner, will be wearing a mask. The patient herself has the choice of whether or not to wear a mask if she's negative. I would really encourage my patients to wear masks, and all the staff are going to be wearing masks. Nurses, residents, doctors, all the staff will be wearing masks. My thoughts on home Dopplers. I will talk about that in a minute because I think that's a great question. Are they effective? Yes. Remind me, I will get back to that question. So again, when you enter, you'll get tested. 30 minutes later, your partner will come in. You have the choice of wearing a mask or not. It's really hard to wear a mask all the time, and it's really hard to wear a mask when you're in labor. So I cannot say to you guys, wear it every single minute and wear it when you're pushing. But to the degree that you can, I think it's wise, just all around. Because remember, there are some false negative tests, and you still want to protect not only yourself, but you want to protect your doctors and your nurses, because ultimately, not only are you nice people, but you're going to need them to be able to take care of you. So the fewer of us as healthcare workers who get sick, the better for the community. Okay, so let's say you deliver, everything's fine, your partner is still going to be asked to wear a mask, and the nurses are still going to be wearing masks because you want to make sure that none of them transmit it to you or to the baby. What if you walk in and you're positive and you didn't know it? That is a bit of a conundrum. And in our hospital, if you walk in asymptomatic and you test positive, unfortunately, your partner cannot be there with you. With the idea being that we don't want to your partner to get exposed, because your partner is the one who's going to need to take care of you and the baby when you get home. The irony is that you walked in with your partner. They're probably already exposed, but as of right now, we are not able to test the partners. Some hospitals might be able to, we might be able to. So again, ask your particular hospital, what is their policy and procedure when you're walking in? Because it differs for everyone, but generally the idea is the same, that they're trying to catch even those asymptomatic people. As a note on that, just yesterday we got word that our lab is able to do the antibody testing, which sounds great. The problem is antibody tests are still fraught with a lot of issues. If you get a positive antibody, and there's a few different antibodies, but the IgG, which means past infection in the last several weeks, the hope is that that IgG will mean protection in the future. But we don't know how long that future is. We don't know if this virus is going to mutate, and we don't know if that IgG is completely specific to COVID-19 or other coronaviruses. So what I don't want for you guys to do is to get antibody tested for some reason, find out that you're immune, and think that that means like lifelong immunization against COVID-19, because we just don't know yet. So I think it's nice and it might boost your confidence a little bit, but it is not something that would have me say stop wearing a mask or anything like that. A note on masks, by the way. So really quickly, when you put on a mask, and I like the ones with, sorry, my dogs are here, with these because they're easier to put on and off. Here's what you don't want to do. Touching your mask. You don't want to do that. You want to make sure you're taking it off and that you're not touching anything and that you're putting it on a surface that you know is clean and you're not touching the outside of it. And that's important because people come into my office all the time touching their mask, and then they're touching their eyes and everything. And that really is going to increase the risk of infection, okay? What should you do with your family when you've had the baby and you come home? And we're going to talk about breastfeeding as well. Let's say you have your baby, you come home, and you want your mom to be there, you need your mom to be there, or your mom wants to be there, whether or not you need her. This is the hard one as well. I mean, I have said before, I am not a fan of busting family relations or ruining your psyche over physical medical issues. Meaning, again, be proactive. Don't be paranoid. Don't be like, Mom, you cannot set foot in my house because that is just going to increase the risk of infection. But maybe say, Mom, for 2 or 3 weeks before you come to visit me, can we at least try to make sure that you're somewhat quarantined? Meaning, can you please just make sure that you are not running to, like, I don't think anyone's playing bridge anymore, but your bridge game and going to the grocery store. Can you make sure that to the degree that you can, you're mostly home. When you are out, you're wearing a mask and washing your hands, and that when you do come to visit me, we are going to actually limit the amount of physical hugging, touching, kissing, things like that. I think that that's a very appropriate way to approach it because you need your family's help, whether it's your mom, a doula, a friend, your aunt, and they really want to be there to help you and to see that baby. Do I think you should allow the entire big family, extended family come visit? No, because that's just increasing risk. Forget of COVID, but of things like RSV, which is a virus a lot of babies get, or the flu. So you want to be cautious in general, and certainly even more so right now during COVID. I don't know if there's other questions about that. And again, that's kind of mine. Can your mom still hold the baby? Again, I think, yes, she can hold the baby if she's been somewhat quarantined, but I would really encourage her frequent hand washing and a mask. And I'm going to defer to, you guys should ask your pediatrician and ask your doctor, because I am not your doctor. I mean, I'm some of your doctor, but not a lot of you. So you should ask other people. Someone had asked a question about fetal Doppler. It's a great question for multiple reasons. But let's talk about during pregnancy. Are you going to be going to the doctor all the time? You guys might know this, that during pregnancy, you tend to go into the office several times. It's about 15 to 18 times for various ultrasounds and then for various visits, which are just, how do you feel? Check your blood pressure, check your urine, and listen to the baby with the Doppler, which is that little machine we use to listen to the baby's heartbeat. Nieces and nephews. I'll answer that question in a sec. I'm going to say probably not. So when you go to the doctor, those are important visits. But the truth is, if you are an otherwise low-risk patient, meaning without hypertension, without diabetes, without twins, without bleeding, without a history of preterm labor, things like that, there are a few visits that you can either skip, and again, ask your doctor, I'm not advocating skipping. You can either skip or you can do them through a telehealth visit. So I'm going to address the Doppler situation in a second. In my practice, for example, yesterday, I had several patients who were in that stretch where you would normally be coming every 2 weeks. So in pregnancy, you typically come every 4 weeks until 28 weeks, then every 2 weeks until 36 weeks, and then every week after that. So a lot of my patients, if they're very compliant and low risk and their blood pressure's been okay, if they're 28 weeks, instead of making them come back at 30, I've said, listen, you can come in 3 or 4 if you're comfortable with it. The patient has to feel very comfortable with it, and your doctor has to feel comfortable. So make sure you talk to your doctor and midwife about their policy. I would feel comfortable in some patients stretching out their visits by an extra couple of weeks. Some doctors are really austerely saying only come in for the most important times, which is the 12-week ultrasound, the anatomy ultrasound at 18 to 20 weeks, the 28-week visit where you check for diabetes and anemia, and then at 36 weeks and every week after that. To me, that seems austere, though the truth is, in an otherwise healthy patient, you really are probably going to have a good pregnancy no matter what. Now, could you buy a fetal Doppler? You could. In fact, I have a business partner who's somewhere on here, Miss Jenny, and she and I are in the midst of creating a pregnancy kit. So I do think it's a great idea to consider having certain things at home if your doctor feels comfortable with it, because then you and your doctor can have a telehealth visit. The one good fallout that has come from COVID in our world is that I think we're all going to feel much more comfortable with telehealth visits, and insurance companies are going to have to reimburse them. So you and your doctor could talk, face to face on FaceTime, and she can have you check your blood pressure in front of her, and she can have you listen to the baby, but it has to be the right population. In other words, if you have risk factors, you really have to be cautious about doing those things on your own. And it certainly, with regard to the Doppler, by the way, should not be used in a circumstance where you're like, I don't think I feel the baby move, let me just listen, because you might mistakenly think you're hearing the baby being okay when you really should be at the hospital being evaluated for that. So again, if you're not feeling the baby move, do this on your own. I can't tell you how many times I hear women be like, I couldn't do it if he wasn't there. Yes, you could. I know you could. You could. You might not want to. It might not be as the way you envisioned it or the way Instagram pictured it, but you guys could do it. Women are tough, strong. We are tough biddies. We can do these things. Okay, I want to get to the question about the C-section. There's a quarantine question that we talked about. Okay, what if you have to have a C-section? All right, is the problem with so many bigger issues going on? I have a baby shower scheduled. Ooh, a baby shower. Let's talk about that in a second. And then, okay, C-section with COVID. Worried when I have the baby. Will you bring it home to your kids? Okay, let's talk first about, this one's an easy one. When you go in to have the baby, will you bring the COVID home to your children? The COVID, I like to call it. Probably not. So J.E. Sullivan, New York City, I don't think you'll bring the COVID home. I mean, listen, we can't guarantee that any person walking in and out of labor and delivery doesn't have it or maternity, but the nurses, the doctors, the residents, the techs, they're really taking precautions. I mean, they are always washing their hands, are always wearing masks. So again, you can't guarantee it, but I think no. Should you have a baby shower? God, I got to tell you, that is like the hardest question because we are, at the end of April, we're almost May and we're talking July. I'm going to punt on that one because we don't know, but I think you have to be really cautious because if you were planning on having, 12 women in a space where you could kind of stay a little bit far apart, maybe, but if you were going to have like 40 women in a living room, that's just unfortunately a lot of potential cross reactivity. So July's a tough one. I'm punting, but I'm saying maybe no. Okay, C-section with COVID. If someone enters the hospital for a C-section, again, they will be tested. This is at our hospital and most hospitals. If you don't know if you have COVID, you'll be tested. If you found out to have COVID, then you will have the C-section, but your partner will not be able to be in the room with you. And the doctors and nurses and anesthesiologists will take slightly more precautions depending on the institution about wearing not just a regular mask, but also an N95 so that any droplets or if something happens where the patient needs to be intubated during the C-section, that the COVID does not get transmitted to the doctors and nurses. Can you still hold your baby afterwards and everything? You can. You just have to take precautions. So in general, let me just touch on what to expect when you're going to have a C-section. If you go to the hospital, you typically get there a couple hours, usually about 2 hours early for the nurses to get you ready. The anesthesiologist comes to talk to you. Again, I'm running through what happens at our hospital. You walk into the operating room, you bend over, you have a spinal for the procedure, and then your partner comes in. And then ideally the C-section is anywhere from 25 to 45 minutes. The baby comes out, and most of the time, if the baby is fine, which is the majority of the time, the baby will stay with you in the room. And while you might be asked to wear a mask, you will be able to hold the baby. There was time where we were really talking about completely separating the babies the minute they were born if there was COVID. For the most part, they're trying not to do that too aggressively because we know that just adds to the emotional anxiety for mom. And we know that for the baby, it's good ideally to have contact. So you have to ask your institution what their policy is on that. I hope that answered your question about that part of the C-section. I know there's another question about C-section healing. So C-sections in general, I'm going to say full disclosure, I had one vaginal delivery and I've had 2 C-sections myself. So I feel like I can talk really openly, not just, as I joke, a hair club member, but also the president. I've been through a lot of them. C-section healing. Let me tell you 2 things that are probably my most important tips that I tell every patient. On the after the C-section side, heat. Put a heating pad on your incision. Don't burn yourself, but put a heating pad on because heat will help the incision heal and it's very soothing. Ask your doctor first. I'm not your doctor. I'm going to cover myself and say that. But heat on your incision is really, really, really good. And it looks like you already have a C-section. So I don't want you to overdo it. You feel great, but don't overdo it. Do not overdo it. Do not overdo it after a C-section or a vaginal delivery. This is not really the time for us to be like, well, my body's telling me I feel fine, so let me go out for like a jog. Your body might be telling you you're fine because you're a really tough, strong person, which is amazing. But after you've had a baby, whether C-section or not, you want to heal and you want to allow your body to heal and you want to allow your blood count to build back up and you want to allow everything to actually get back to as close to its previous norm as possible. So running outside or doing all kinds of laundry is not the way to do it. In the old world, back in the day in nature, we weren't doing that. We were sitting and resting and we had our gaggle of women come help us and take care of us like a village, right? In the modern age, women are like, oh, I feel good. I'm going to run to Starbucks. I'm going to take a yoga class, all these things. I really, really would discourage you guys from doing that. For the first 6 weeks, I would really be restful. And I'm saying that not just as someone who loves being restful and being lazy. I would really rest. My other tip, by the way, pre-C-section, for any of you out there, if you're going to have a C-section, my tip that I tell every pregnant woman that I can remember to tell before she's going to have a C-section with us is not to just not have food or water after midnight, but to actually wake up in the morning the day before, eat whatever you want till 12 o'clock, no more solid food after 12. This actually holds true for an induction as well, by the way. So whatever you want till 12 p.m., after 12 p.m., tons of liquids, including thick liquids, soups, smoothies, shakes, because those will keep you nourished so you're not starving, but then you won't have a whole belly full of poop that you have not pooped out by the next morning when you either have your C-section or your induction. Because what happens during a C-section or when you get induced, you might get narcotics. Narcotics slow down your bowels, and then you can't poop, and then you're constipated. And Lord have mercy, y'all who've had babies will agree with me, right? I hope you're nodding your heads right now that when you have a C-section or you've had a vaginal delivery and you can't poop, you feel like it is harder than getting the baby out. And so the more empty your bowels, the better. You need your stomach to be empty for safety for the C-section, but you want your bowels to be empty for comfort. Take it from me. I did it the wrong way the first time I had my baby. So whatever you want till 12 o'clock, tons of thick liquids after that, and even a stool softener or a laxative later in the afternoon to poop out everything before the next morning when you have the C-section. Okay? I hope that answers. Clarify. C-section, what should you expect upon arrival when you're at the hospital, and how long will they have you there? Okay, so every C-section is different. Every hospital is different with regard to how long you stay. At our hospital, patients are allowed to stay 2 nights for a vaginal delivery and 4 nights for a C-section. It tends to be, I shouldn't say hospital dependent, by the way, state dependent. I believe New York State only allows 3 nights for a C-section, but I'm not sure. Many of our patients have asked to leave early, so as long as the pediatrician allows the baby to go, we would let you guys leave early. So after a vaginal delivery, most states require at least 24 hours for the baby to stay. Some of the babies have left even a little bit before 24 hours if the pediatrician feels comfortable. And that's just because moms want to get home to avoid COVID, obviously. For a C-section, again, in Connecticut, we allow 4 nights to stay. Many of my patients have left after 3 nights, and I've had a couple who've wanted to leave after 2. As long as their blood pressure's been fine, their bleeding has been fine, and there's no sign of infection, they can go home as long as I really know that they're going to go home and be restful. So to answer your question about how long they're going to keep you, at the most, I'd say 4 nights, but the likelihood is they'll let you go after 3 nights if everything is stable with you and with the baby. Okay, pregnant and moving. We're moving on Thursday, Jackie. Okay, so you had to get movers. Should you just stay away from them? Yeah, I mean, listen, I think that movers, so there's a question, guys, about this patient is moving and she has movers coming in. What should she do? Well, first of all, she should not be lifting really heavy things. And I'm not going to say don't lift anything heavier than 25 pounds because someone made up that number. There's no data to say how many pounds, but you got to use your judgment, and please do not be lifting anything heavy because you can have contractions or bleeding, and I don't want you to do that. Should you stay away from the movers altogether? In a perfect world, I'd say yes, or at the very least, stay really far from them. And the truth is that we know that virus can actually live on cardboard. And you guys have probably seen that chart that they keep putting on CNN. It can live on like copper and metal and plastic and cardboard. And, you know, does it live on dog hair? Who knows? So you have to be really careful about really washing your hands frequently if you're going to be with movers and touching boxes that they're going to be touching. So yes to mask for sure. Maybe to gloves. You might notice I didn't talk about gloves because gloves are a hard one, you guys. When people wear gloves, they very much mistakenly think they can touch all kinds of things, and then they're still touching stuff with their gloves and not necessarily taking off the gloves and changing them frequently. So I'm a little torn on gloves and what the right thing to do is. I don't really know. There's not great data. You can wear gloves, but make sure you throw them out frequently, okay? All right, let's see. What else? Does grandparents quarantining for 2 to 3 weeks before the baby and protocol apply every single time the grandparents see the baby? Interesting. I'm not sure I get that question, but you're asking, is it every single time the grandparents see the baby? Every single time they see the baby, they should obviously be washing their hands and wearing masks, I think. Do they need to quarantine every time? Meaning, do they leave and come back? I mean, then yes. I think if they're going to be leaving and coming back in an ideal world, listen, I think it's hard. What if you have a grandmother, your mother is still working, for example, and she wants to come visit? I'm not going to tell you you should ban her from seeing the baby, but I would say you should probably be cautious in making sure that depending on where she works, she's being very cautious about wearing a mask and, again, washing her hands. Babies, vaccine are an interesting question. For the most part, babies will not be fully vaccinated against a lot of things for anywhere from 1 to 6 months. The pertussis vaccine, for example, which are all recommended to get from 27 to 32 weeks of pregnancy, 27 to 36 weeks of pregnancy, that's to protect against pertussis, which is whooping cough, and all your family members and your partners should all get it as well. That particular vaccine, the baby will get DTaP, which is their version of ours, which is Tdap, but they won't be vaccinated until they're 6 months. So it takes a while for babies to be fully vaccinated. In the COVID era, have the post-birth procedures changed? Immediate skin to skin, the baby being taken out of the room. So again, it very much depends on the hospital. If you are found to have COVID, they will let you hold the baby, but they would very much encourage you, again, mask, frequent hand washing, trying not to breathe on the baby because you don't want respiratory and you don't want any of the droplets to come out of your mouth. Sorry, I think the wording was confusing. Hold on. Even if my parents have quarantined for a few weeks, should we still wait another 2 weeks after coming home so we don't risk giving it to the grandparents? Good question. Okay, so this person just asked, if her parents have quarantined so that she knows she and her baby are safe from her parents, should she herself and the baby quarantine themselves for 2 or 3 weeks before exposing her parents to what she might have brought home from the hospital? Again, here's a really hard point, you guys. In an abundance of caution, if your mother, for example, God forbid, has really bad lung disease and you're worried that she's going to get it from you, yes, I think it's appropriate to be cautious. But in the absence of that, I think we have to use our judgment. And again, at the hospital, the people there are really using more precautions than anywhere else because they're all wearing masks. They're all washing their hands really frequently. That's like our standard procedure anyway. So that is something that's really personal. I think you have to decide with you and your family who wants to be the most cautious. Okay, I'm due in September. If my husband needs to go into the office by then, should we quarantine away from him? By September, we're going to have more information. So again, I don't know. I mean, really anything in the next month, it's going to be very hard for any of us to say what's going to happen because we just don't know. When we find out more about testing, we'll then be able to say how many of us are immune. Will we know how long the immunology lasts? We don't, but at least we'll know how many of us are immune and things like that. So I don't think you need to quarantine from your husband. I mean, even right now that I go to the hospital frequently, I don't fully quarantine from my family. I haven't been letting the kids hug and kiss me as much. And there was a while where I was sleeping in a separate room downstairs away from my husband. So I think, again, with caution, you guys can be pretty safe, right? If you test negative... All right. If you test negative, can the partner stay with you while I'm at the hospital when I'm having a C-section? Oh, yeah. If you test negative. So again, at our hospital, everyone might be different. You are allowed to have one partner come in with you. That one partner has to be the same person who stays with you the entire stay. They have not, again, in our hospital, said that the partner can't leave the hospital and come back, but they've really discouraged them from leaving and coming back so they don't bring anything back and forth. But you can't switch it out. You can't have like your husband today and your mother tomorrow. It's one partner that stays the entire time. And as long as you are negative, they stay the whole time. Now, none of you guys asked, what if the partner is positive? And the truth is we don't test the partner yet, but the partner is wearing a mask the entire time. And I hope we get to the point where we can test the partner too, just because I think from an epidemiological point of view, it'll be better to have all that information. Okay, pregnant. Do you think eating carryout is okay? Good question. That's not a silly question because, Lord, I'll tell you, at the beginning, one of my best friends and I had this whole conversation about pizza. Should we be ordering pizza? Should we be ordering anything? And honestly, early on, I was a little more reticent to order any food because it's not the food. The food is hot enough that the virus probably won't last. But the containers, I mean, imagine they're putting, at least pizza is one box. You order Chinese takeout, you got like 50 boxes. So let's talk about groceries and let's talk about takeout. Like anything else, you have to use caution. So do I think you can still order? Yes, I think you can still order. I think you should be cautious. I think you should try, if you're going to touch the containers, wash your hands. Make sure that when you empty the container, you don't touch the container, empty your food, and then use this hand to like pick up a burrito, for example, all right? So just to the degree that you can, use caution. That's not silly, by the way. That was really important because food is so important. Oh my gosh, someone wrote here, I'm terrified of the pain of delivery. Any of my people who are watching, what am I going to say about using the word terrified? Please, please. Ramona Anthony, don't use the word terrified. Here's what I want you to reframe. Here's what I think you mean. You mean, oh, I'm really anxious about how painful labor is going to be. And here's the truth, sister. Labor is painful. But you don't have to suffer, because once you have pain, you'll talk to your doctor or midwife, and then you'll decide if you need pain medicine. If you need pain medicine, you're going to get your epidural. And I'll tell you that sometimes my patients will say to me, oh my God, I'm just so scared of the epidural. I'm so scared of the needle. And as I joke, really, let me tell you something. When the pain comes, you're going to feel like I did, which is, if it's that bad, you're going to say, stick the needle in my eye. I don't care where you put it. I need pain medicine. If in that moment you're scared of the needle more than your pain, then that means you're actually dealing with your pain really well. So the best way I can say it, Ramona, is don't be scared. I can't lie and say that labor is not uncomfortable. Labor, I'm telling you from the doctor's point of view and the patient who's been through it, labor is uncomfortable. But once you get your epidural, it's a whole nother world. If you want your epidural, you might get to the point where you feel like you can do this on your own, because in between the contractions, you actually really, really might have enough reprieve that you can collect yourself and soldier on. And listen, I'm not even going to say more power to you, because I'm going to say power to any of you who birth any which way, whether it's vaginal or C-section, whether you nurse, whether you give your baby breast milk that is pumped, or whether you gave your baby formula. More power to all of us. And by the way, shout out to any of you who cannot or choose not to have babies as well. If you are living and breathing on this earth, more power to all of us, okay? So if you want to do it without pain medicine, I'm going to say God bless you. I don't know if I'm going to say more power to you, because I think that's tough. Thoughts on the hospitals that are not testing pregnant moms? I got to say, I'm worried for those hospitals that can't. And obviously from a resource point of view, some hospitals just can't. I think they have to be really, really cautious. And maybe the truth is, maybe it's going to be better, because maybe they're going to be even more cautious, and maybe the rest of us have false negatives. But they need to be very cautious about hand washing and masks. Consider diarrhea or congestion possible COVID symptoms. So here's what's also interesting. You guys probably know that the typical COVID symptoms are a fever and upper respiratory issues, but you've all read that there are myriad other symptoms that seem subtle that could be COVID in other with other presentations. I think all of us have had that moment of like, oh my God, I must have had COVID, or oh my gosh, like I had that little bit of like when I talk too much, or when I'm talking with my mask, I can't breathe and I must have COVID, or like I had diarrhea a couple weeks ago, I'm sure I had COVID. Like I think we all have that notion, which is why I'll be curious to see what happens with the antibody testing. Would I assume that congestion or diarrhea, like you're asking, means COVID? I would not assume it, because I think there's just so many other reasons for diarrhea and congestion. I know of us. There was a spouse who was banned since wife had one of those symptoms. That is very surprising to me, and I'm sorry to hear that, because that's going to ban a whole lot of people, because diarrhea and mild congestion are very common, especially, many of you probably know, you can often get diarrhea when you're in labor, because the contraction of the uterus leads to contraction of the bowels, and pregnant women are congested all the time, not to mention we're in spring, like congestion season. I'm a little nervous, thank you for saying it like that, because I have seasonal allergies and don't want my spouse to be banned. I mean, the truth is this, I don't know what to say about that, because you're right. I mean, seasonal allergies, I'm surprised to hear that there are hospitals that are banning partners just because the woman might say she has. When you say seasonal allergies, I'm assuming nasal congestion, and that's it. You can certainly, first of all, ask your doctor, but you can safely use things like Nasonex, allergy pills like Benadryl, Zyrtec, things like that. Keep my July schedule C-section or wait for natural labor. First time mom, want to be in the hospital here. Very typical pregnancy. That's a really big question. Here's the tough part. I don't know what was the reason for your scheduled C-section. You're type 1 diabetic. I can't say that's a reason you need the C-section. I'm a proponent of you doing either delivery, by the way. But without knowing the other details, maybe you should feel free. You can always write me a message and let me know what you're thinking, because I wouldn't say do or don't do the C-section in any different way based on COVID. In other words, one thing I should also say is COVID is not a reason for a C-section, but it seems that the preponderance of women who are affected with COVID, who are sick, not just infected, but affected, meaning had symptoms where they were very sick, had very much trouble pushing because they went into respiratory distress and decompensated. So it seems like there's a higher C-section rate in women who have COVID, who are sick from COVID, not just tested positive asymptomatically. Because again, it's not a reason to do a C-section, because it does not save the baby from getting exposed to it, because we know that it does not seem to transmit through the amniotic fluid or anything. So that's a hard question for me to answer without knowing why you were going to have the C-section in the first place. But if there was a reason, even if the reason was just you really wanted it, I would not say, oh, you have to do it vaginally just because of COVID. Do we recommend any family members or friends coming into contact with the newborn to have up-to-date shots? Yeah, I mean, ideally, listen, I'm a proponent of everyone having up-to-date shots, especially the pertussis vaccine, which is something you can encourage them to have, the Tdap, tetanus, diphtheria, pertussis vaccine. Anyone who you're going to see really should have that updated. That's like a public health guideline. Every 10 years, we all should do it. What if grandparents are still socializing 6 feet apart from their friends? Is that enough distance? I'm torn on letting my grandparents hold the baby. And you love my jacket. Thank you. My jacket is actually from Target. It's very fancy, I know. For those of you who don't know me, I usually wear a whole lot of jewelry. I've pared it all down because of the COVID, because I don't want to have more places for all of the virus to kind of settle on my neck and stuff. I got to tell you, if your grandparents are socializing 6 feet away, let's be honest. You guys have tried to socialize 6 feet away sometimes, haven't you? Because we've tried, and we've pretty much done it. Like my friends and I, if we're stood in the driveway, we've pretty much stayed away. But let's face facts. Every couple of minutes, you might get like 4.5 feet away. So I think, to be honest, when it comes to infants and pregnancy and pregnant women, let me just reiterate that the data so far has been far more encouraging than we would have thought. I'm thrilled. But let me also reiterate that you guys are a population that we want to be more cautious with. Pregnant women and babies, we want to be more cautious with because of the unknown. So if it were my parents who were still socializing 6 feet away regularly, I'd probably say don't come by for a couple of weeks. Listen, if they saw one friend once who was 6 feet away, okay. But if they're kind of regularly having like their, mahjong game 6 feet away, I think that the likelihood of that really authentically being true is very small, and then they're just increasing the potential chance. And you just don't want to have someone bring something home to the baby and then be stressed out and anxious about it. If it was my child, would I be okay with them trying to get pregnant now or want them to wait until this slows down? I'm 36, husband is 39, already have 2 healthy kids. Okay, meaning, is the question, would you be okay with them trying to get pregnant now? Oh, if it was my child, meaning if my daughter right now wanted to get pregnant, would I be okay? Yeah, I mean, if she asked me, she's 9, so she won't be. But if she asked me, I would be okay, though I would say to her, I said this at the beginning, I'm not sure if you were on, that I think I would absolutely advocate for my patients, my sister, my daughter, to get pregnant right now if they wanted to, but I would really caution them, as I have, and say, you know yourself best. Once you get pregnant, there are things that might come up that are going to create a need for you to go to the doctor more frequently. And those things might not be predictable. You might have bleeding, you might have spotting, you might have pain. Things might come up. If you're going to be really anxious about going to the doctor right now, then that's a reason not to try to get pregnant right now. Similarly, if you're going to get pregnant right now and then watch the news like a hawk and scour Dr. Google and allow Dr. Google to scare the crap out of you every other minute about the potential for COVID, then I would not get pregnant. Does that make sense? So again, medically speaking, I can't say don't get pregnant. It's an emotional issue right now, I think. Grandparents quarantining but need to travel overseas to see us. I know, that's a tough one too, because they're going to be on an airplane. And listen, I'm not an engineer, but I thought that being on an airplane really increased your risk of all kinds of infections. I was told by someone recently that the airplane is safer than if you drove, which makes 0 sense to me. I'm only a doctor. So I'm going to say I think that a flight makes me a little bit nervous. I got to be honest. Thanks so much. You're welcome. Is there any way I can have my husband rewatch this? Oh, that's a great question. So after I finish this, it's going to be saved and I'm going to send it to the girls at Hatch. I think it saves on their feed for 24 hours on their Instagram Live. And then I'm going to have it as well. And I'll probably put it on my feed at Big Love Fierce Juju if you want to join me. If the stay at home is lifted and I have the opportunity to go back to the office, that's a great question. We didn't talk about work. Or should I opt to work from home for the duration of the pregnancy? Okay, great question. I have a lot of my patients right now who are pregnant and they are nurses on labor and delivery. So they were not only working, they were working in the thick of it where they were getting exposed. And there was no rule. Every society in the OBGYN world actually had a different rule. Like the Royal College of England had a very different dictum than the American College of OBGYN, and they actually said that pregnant women after, I believe, the 3rd trimester should stop working in the presence, pregnant healthcare workers should stop working. We did not say that in America. I kind of wish we would to make it easier. I had a lot of discussions with my patients who were nurses who were working with COVID patients about whether or not they should be working. And the answer is, while we don't think it's preferentially affecting pregnant women, it would make me anxious and nervous. And since I'm not a fan of anxiety and nerves, I encouraged them to stop working if they could. This, again, is where you know yourself. If you can easily work from home, of course, why not? Why wouldn't you just decrease the risk and decrease the exhaustion and work from home? If you said to me, listen, if I don't go to work, I literally make no money and my entire family relies on me, then I would say go to work with precautions, okay? So again, there's no black and white answer, but I think if you can stay home, great. If you can't, then go, but be cautious. Trying to decide about trying to conceive. I know. Trying to conceive, it's such a tough question. So I've said it a couple times, but again, I'll keep saying, I think it's fine to try, but you know yourself best. And if you're going to be really anxious, then hold off a couple of weeks. The governor has opened small businesses. I was waitressing before the outbreak for extra money. I had the option to go back. I mean, waitressing is a hard one because you're going to be near a lot of people, though to be honest, I guess when you're waitressing, you're standing up and they're down there. So if anything, the customer is more at risk than you are, because you're going to be talking to them where a little respiratory droplets could get on them. I am assuming you would be wearing a mask, but let's face it, they're not going to be wearing a mask because they're going to be eating. So I talked to a friend of mine the other day. How are they going to be opening up restaurants and bars? I mean, someone needs to come up with a mask that has a hole in it so that people can actually drink from a straw, like drink a margarita at a bar from a straw. Not pregnant people, obviously, by the way, you don't drink. It seems as though asymptomatic risk is high, even if we quarantine for 2 weeks after delivery and have grandparents quarantine for 2 weeks. Is it safe to allow them in the house? I think it's safe to allow them in the house. I think it's safe to have them hold the baby, maybe. I think you should make sure, again, mask, frequent hand washing. In an ideal world, if they could get tested, that'd be great. The truth is, yes, you're right. You can be asymptomatic, negative, and actually that could be a false negative. You can be asymptomatic, have corona antibodies, and they don't know if it's COVID-19 antibodies or other corona antibodies. So there's no 100% answer. So can you guys get that my common theme here is, in general, it might be okay, but use precautions. And most importantly, you know yourself. If banning your mom from your home is going to cause a huge amount of anxiety and distress between you and your mom, versus having your mom in your home where you're going to be anxious every minute that she's touching the baby, you really have to make a decision in between those two. And neither has to be, exhaustive. You can have her maybe come a couple of times a week, or come and hold the baby for certain periods of time and then kind of sequester herself other periods of time, and make sure she's always wearing a mask, and make sure you're all washing your hands. After the first trimester or after 20 weeks, or do you think it would be safe with a mask? I think you mean about going back to work, because that just says ... after. So I would always go back with a mask. I mean, always for now. Could you go back in the first trimester or 20 weeks? Either one right now seems okay. If you have to go back to work, you can go back to work. Let me just be clear. If I were pregnant right now, I would be working because I have to work and support my family. I would definitely be working, but I would be wearing a mask as I do in the office anyway, and I wouldn't be scratching my face, and I would be probably slightly more cautious than I am right now. I've heard mixed reviews on C-sections, the amount of pain you have while having a C-section, how long is the recovery after a C-section? So C-sections, hi Meredith, you're so cute. I could do a whole nother IG live on C-sections, people, because I've had two by choice, because I had a vaginal delivery that was dreadful. Vaginal deliveries are amazing. When they are good, they are so good. It is like my favorite thing in the world to do when it's a good, easy, happy vaginal delivery. When it is not, it's my least favorite thing ever to do. Okay. So in the hierarchy of how you heal and how easy it is, if you ask anyone who've been through this, a quick, easy vaginal delivery is like the easiest to heal from, right? Now, I'm not going to talk about what happens 20 years when you might have incontinence and things like that, but all joking aside, healing, quick, easy vaginal delivery where you haven't pushed for like 3 hours. Second easiest is you walk in and you have a C-section. You walk in, you don't have labor, and you just have a C-section. And that's what I did. Third and fourth, close third and fourth, which are really hard recoveries, are long labor, long pushing, and a vaginal delivery, or long labor, long pushing, and a C-section. Those are both really challenging to recover from. I had a very challenging recovery from my vaginal delivery because I pushed for 3 hours and I was very swollen and all these different things that were happening. So for my C-sections where I walked in, mentally prepared, my bowels were empty, my recovery was fine. Did the incision hurt? Yes. Did it hurt as much as my vagina hurt after my vaginal delivery? No. That does not mean that C-sections are right for everybody, because some people have wonderful vaginal deliveries and terrible C-sections. So I really want us all to stray from the notion that there is all good or all bad. One of my many quotes that I really like, people are probably sick of hearing me say it, I say it all the time, is now I'm not even going to remember it because it's so complicated because I made it up myself. But nothing is ever only, everything is always and. Okay? Say it with me, girls. Nothing is ever only. Everything is always and. Nothing is ever only good or all bad. Everything is always pretty good and a little bit bad, or really bad and a little bit good, right? Let's hope for the first, not the second. So I can't say C-sections are terrible to recover from, because I had two that were fine to recover from. I have had patients with really challenging recoveries and some patients with great recoveries for vaginal and for C-section. Recovery after a C-section, it depends on what you mean. Meaning, after my vaginal delivery, I had a catheter for 2 days, and I could barely sit for about 6 weeks initially, but then 8 months it hurt. Whereas after my C-section, I had my catheter in for 24 hours and I was walking around by a week easily. That was my particular case. So it very much depends. So recovery after a C-section or a vaginal delivery will depend on the circumstances. Hi, Meredith. You're so cute saying that. Okay. My mom had COVID early in the pregnancy. Are there any known increased risk to fetal development if a mom had it? So far there is no risk that we know of the virus itself getting to the fetus and causing issues the way, for example, Zika did. So the good news is, so far, no. The honest answer is that in the next year or two, when we have more of a registry, because there are a couple of physicians who are wonderful, who are creating registries so that we can actually document patients who were pregnant, how they delivered, what were the complications, were there more miscarriages, was there more preeclampsia, was there more preterm labor, what was the C-section rate, why, were there any more birth defects? So all of that is going to be, really, we'll know more in the year or two, because that's how long it's going to take for all these women to be pregnant and then be examined. But as of right now, it seems that the women who have been tested positive for COVID, in China, for example, their babies have been fine with no known birth defects or anything. Wow, would have loved to have you. Oh, you're so sweet. Thank you. I would love to have been your doctor. Okay, what are your thoughts on epidurals? My thought is, hell yes, I loved my epidural. But my honest thought, like anything, is it depends on you. My patients hear me say this a lot. I really want you guys to go into your labor or your delivery, if it's a C-section, or your pregnancy, or you're trying to get pregnant, or your fertility or life with an open mind. And don't be hell-bent on one thing. In other words, if you go in saying, I have to deliver vaginally and I'm never going to have an epidural, I hate to tell you, that's maybe not going to happen. And if you believe in manifesting, when you say things like, I'm never going to have an epidural, you're manifesting a lot of not good things. Or if you say, I'm not going to have a C-section, you're manifesting the things that you don't want. So I really encourage my patients to go into it saying, I'd really like to try vaginally, and if all goes well, I'm going to have a vaginal delivery, and I'm going to see if I have pain, I'm going to get an epidural, and if I don't have enough pain where I need it, I'm going to deliver without an epidural. And if for some reason the baby seems to need a C-section, or my body doesn't seem to like trying vaginally, then we'll do a C-section, and that's okay too. I really feel like when patients go into it with that mindset, they do very well. Not only do they seem anecdotally to have a higher rate of vaginal deliveries, but when they do ultimately need a C-section potentially, they're not fraught with anxiety and fear and discomfort and anger about the C-section. They feel like, listen, I tried vaginally, it didn't work out, and I had a C-section. And I really believe if you approach it like that, you're going to be fine either way, because they're both good. But epidural, I love, because I thought it was much more pleasant. But that's such a personal thing. Patients who don't want an epidural, I support them if they really don't want it. I want to hang with my parents. What are the boundaries I should put in place? Okay, so I'll be honest. Like, I am literally looking out the window and my parents live 2 doors away from me. So when people are like, I can't see my parents at all, I still see my parents. They're 80 and 83. And we see them, I mean, not every day, but almost every day between work. And we're not hugging and kissing the same way. We are being a little bit more physically distant, but we're not like in each other's houses 6 feet away, but we're being as cautious as we can. Now, again, could we completely ban ourselves from seeing each other because I work at the hospital and I go to the office and, oh my God, what if I bring it to them? We could. But do I think that would be healthy for anyone's psyche? No. And I firmly believe that the detrimental effects of damaging my parents' psyche because I've banned them from seeing me and my children, or damaging my children's psyche or my psyche from never seeing my parents, wouldn't be healthy net. So we're being cautious. We're not hugging and kissing as much. We're not with each other as much as we would have been before, but we're still seeing them sometimes. You are so welcome for answering your questions. 38 weeks. Congrats. You're going to do well. Hi, Parent Collective. Hi, Peyton Turner. Oh my God. Can I recommend an OBGYN in New York City? Actually, I can. And I'm not advocating for any one person, because there's thousands of OBGYNs in New York City who are truly wonderful. I mean, God, they are on the front lines. When people say to me, I'm on the front lines, I am not on the front lines, sister. I am like feeling luxuriously. I mean, I see patients every day and I'm working my ass off, but we are lucky. Stanford has been hit really hard, but our labor and delivery has been really, really relatively calm, and I almost feel guilty about that. I know Dr. Jennifer Butt, B-U-T-T, no joke, that's her name, at Lenox Hill, and Dr. Abe Shahim, S-H-A-H-I-M. They're both wonderful, and Dr. Shireen Russell. All three of them are actually at Lenox Hill. Coincidentally, I know each of them unrelated, but all at Lenox Hill. But there's excellent doctors. I mean, literally all throughout New York City, Columbia, Cornell, all the hospitals. Hairstylists in San Diego. The salons are closed. Yeah, my mom's best friend is a hairstylist, and they're closed. And if they open before your due date in June, oh, honey, that is a tough one. Listen, again, if you said to me, I have to go back to work to pay my rent, I would say go back to work, wear yourself a mask, and ask all your clients to wear masks. And really ask your secretaries or whoever books your your clients, to screen them, and really implore them to not come if they have symptoms or have a fever, to protect you and themselves. That said, if you don't have to go back, listen, you're going to have a baby. You're not going to have a lot of time to rest later in life. Take this opportunity, lay down and rest as much as you can. Hi, Shab. I love you too, Peyton. Okay. You're so cute. All right. Guys, I feel like I could talk to you guys forever, but it's been an hour and I feel like they probably want to kick me off the feed, but I'm going to answer a couple more. I weighed 104 pounds before getting pregnant. I'm 5'4". Lord, you sound amazing. I want to be 100 pounds. Is a vaginal delivery still possible despite my small size? Yes, absolutely. I have seen some of the teeniest, narrowest, shortest, skinniest women deliver big babies. And listen, when I had my first baby, I was 250 pounds and it was hard for me to get out a 6-pound kid. So I was big and couldn't get out a small baby. So it has nothing to do with your weight, to be honest. So it really has to do with the position of the baby, the shape of your uterus, and the shape of your pelvis, none of which I can tell based on 104 pounds. But God bless you. Okay, hold on. There was one more question. In the time of COVID, do moms have the option of choosing to have an elective C-section? So here's the truth. You have the option of choosing a C-section really anytime, depending on your doctor. So it's a big and controversial question, which I would talk about ad nauseum. But depending on the doctor, you always have that option. I firmly believe you should always have that option, COVID or not. That is controversial for me to say, but I'll say it. I could talk about this really for a long time, and you can tell I have a lot of opinions. But yes, so the answer is talk to your doctor. And 35 weeks, doctor wants to induce at 38 or 39. I mean, it depends on the reason for the induction. In other words, there's a question here, 35 weeks, doctor wants to induce at 38 or 39 weeks. What are my thoughts? It totally depends on the reason. Our hospital has really discouraged us from elective inductions, meaning inductions just purely because they don't want to clog up the labor beds and, all the equipment that we have, and they don't want to increase the amount of time of patients on labor and delivery. And when you get induced, you are potentially going to be there longer. So if you have a medical indication, high blood pressure or diabetes, there's something concerning about the baby, then of course you should be induced. If it's purely elective, our hospital hasn't said 1,000% no, but they've discouraged it. And I've discouraged it with my patients as well, if we can. So that's my answer. Okay. Is it a bad time to try and get pregnant? Had a miscarriage and I'm so anxious. I'm sorry you had a miscarriage. I had 6 and it is really crappy. And let me just give you hope that you will have a baby. I promise you. There's no reason to think you will not have a baby. I don't know you or your circumstances, but I can almost guarantee based on cold, hard statistics alone, forget emotion, that you will have a baby. That said, I said this earlier, you know yourself best. If getting pregnant right now is going to increase your anxiety because of COVID, then wait it out another couple weeks until we know a little bit more. But I would not otherwise tell you you shouldn't get pregnant outside of just the logistics of having to kind of see your doctor more frequently potentially, and just what that causes anxiety wise. Thank you for saying nice things. Pregnant with my 4th. God bless ya. If you've seen complications with marginal cord insertion. I have seen so many marginal cord insertions. Right now, I'm sure I have like 20 of my patients have marginal cord insertions. And just to answer you guys, there's a question about a marginal cord insertion of the placenta. The placenta is round. The cord usually implants right in the middle of, like, if it's a disc, right in the middle. Sometimes you'll have marginal cord insertion where it's off to the side. And in theory, if you have a marginal cord insertion, you're watched a bit more carefully because it might increase the chance that the baby doesn't grow as much. So you might have growth restriction because the placenta itself might not behave perfectly. I will tell you that we do watch our patients with marginal cord insertions, and occasionally we have a patient who's growth restricted, but the vast majority of babies are totally fine. Recently, one of our patients had like an 8.5 pound baby, and we were laughing about, like, look at that growth restricted 8.5 pound baby. Okay, so high risk, but cardiologist doesn't agree. She was okay with 40 plus weeks. Okay, so this patient whose doctor wants to induce at 38 or 39 weeks, but the cardiologist says 40. Honey, that is such a hard question. I wish I could answer. I don't want to go against any of your doctors. That is where, again, if you were our patient and your cardiologist was comfortable with you waiting and you did not want to be induced, I would let you not be induced, but that doesn't mean I'm right. You really got to talk to your doctor about that one. That's a tough one. Okay. Should you be worried about placenta previa? Okay, guys, this is going to be the last question because I've been here for an hour and I love you guys. I could keep doing this, but I do have things to do. Placenta previa. Again, I'm going to abbreviate this, but placenta previa is when the placenta, if this is your uterus, the placenta is sitting on top of your cervix instead of off to the side or in back or on top. Placenta previa, unfortunately, can cause problems, but most of the time does not. Meaning, you have to be watched carefully to make sure the baby is growing. You have to be cautious about exercise and intercourse, meaning you don't have intercourse, you don't exercise if your placenta is on top of your cervix because it can lead to bleeding. And you wouldn't deliver vaginally because the placenta is in front of the cervix. So as the uterus dilates, the cervix dilates, the placenta can actually, unfortunately, bleed. So you would have a C-section typically at 37 weeks. Just had a patient a couple weeks ago with placenta previa. She did fine. We took all the precautions and she was great. She went home actually after 3 nights, maybe 2. No, 3 nights. So that's a short answer to a bigger issue. But again, to comfort you, the vast majority of placenta previas do fine, provided they are watched and their doctor takes the precautions they need. Someone asked about my necklace. Okay, I usually have a ton of necklaces on. This is an abbreviated version. There's a couple of teeny little charms from Jennifer Fisher, and then this is an earring. I have a sister I'm very close to. I bought a set of earrings, and I was going to make them each into pendants, but nobody could do it because it was too hard to solder, so I turned the earring into a pendant. And then I did my nails like evil eyes. Okay, and that's it, girls. Thank you so much. Any of you who don't follow me, please feel free to follow me at Big Love Fierce Juju. I really, like, the purpose of my feed is absolutely to teach you guys about OBGYN in a way that helps you decrease your anxiety, okay? Because I say to my patients all the time, there's a lot of crap out there, and I am not going to promise that you guys aren't going to get stuff. I myself had ovarian cancer almost 4 years ago, but I am fine. So I will not promise that you won't get stuff, but I will promise that if we all keep our wits about us and we kind of go through things in a very pragmatic thought model, we can get through anything. We are women. We are strong. So really, 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 just keep that in mind, okay? Good luck to all you women who are trying to get pregnant, going through fertility, birthing, nursing, choosing not to have babies. God bless you people, because you might be really smart. There's a lot of different aspects of being a woman, and I'm deeply committed to delivering babies, and I have babies, but I really also want to urge us not to feel as though we are solely defined by our motherhood, because we are not. Women are so much more than the divine mothering that we do, okay? Okay. And we have some projects coming up ahead, so stay tuned, because the patient who asked about the Doppler, there's a couple of things going on. We're going to have a membership model at some point to talk about OBGYN issues and holistic nutrition with me and my partner, my business partner. And we're going to have a pregnancy kit that we are in the works of making so that people can do some of these telehealth visits at home, and it would help you and your doctor. So lots of stuff in the pipeline, and love to you all, okay? And thank you again to Hatch Collection. Okay, bye. How do I do this? I got to end it and then save it. Okay, bye.
Hello, everybody. I'm Kelsey.